Okay, good afternoon, everybody, and welcome to today's webinar, Cannabis, What Does It Mean for Me? So there's quite a few people on the line today, which is great. My name's Kathy Arsenault. I'm the practice consultant for the Association of New Brunswick Licensed Practical Nurses. And alongside me today is Susan Duff, who's our Director of Registration and Policy. So this was the presentation that we did for our AGM back in May, and we thought it would make a good webinar. If there's folks you know that might be interested in this webinar, we are recording it, and we'll make sure that that gets uploaded to our website if you want to share it with anybody. So this afternoon we're going to present on the topic of cannabis and how it impacts your nursing practice. So we know that cannabis became legal in Canada in October of 2018, and we've really seen an increase in use for medicinal purposes amongst our patients. So because of that, it is important to understand what that means for your practice and understand the kind of policies that can go along with that. So I'm going to start the presentation this afternoon discussing the issues surrounding cannabis and your nursing practice. And then Susan's going to discuss the policy side of things as it relates to cannabis. At the end, we will open it up for Q&A, and hopefully we'll have some good discussion. So I'll start today by discussing some of the differences between recreational cannabis and medicinal cannabis. So as you'll see on the screen, recreational cannabis is generally used for its euphoric effects because it does contain the psychoactive ingredient of THC, which is tetrahydrocannabinol. So this became legal for recreational use on October 17th, 2018. And to obtain cannabis for recreational purposes, you don't need any special authorization, you don't need a doctor's order. That being said, there is some legality surrounding that. You know, obviously there's an age restriction, there's a restriction on how many plants you can grow if you are growing your own. On the medicinal side of things, it's generally being used to alleviate symptoms of a certain disease or disorder, and it contains the non-psychoactive ingredient of CBD, which is cannabidiol. And often it has little to no amounts of the psychoactive ingredient of THC that we see in our recreational cannabis. So we've seen medicinal cannabis being used for chemotherapy patients, people suffering from diseases like multiple sclerosis, and in palliative care environments, just to kind of name a few. And the history surrounding the legalization of this is lengthy, but in short, in 1999, the federal government first issued exemptions to allow certain individuals to access cannabis for medicinal purposes. That was then replaced by a regulatory framework in 2001, and that allowed people with certain illnesses such as HIV to obtain it. And then that just continued to morph into where we are today. And today, in order for you to obtain it and use it for medicinal purposes, individuals have to have an order and they have to have a signed authorization form. So this brings us to today, and how do we go about obtaining that? So both recreational and medical cannabis are governed by the Cannabis Act and the cannabis regulations. So the Cannabis Act provides the statement of law on cannabis. So it tells us what's allowed and what is prohibited. It treats recreational and medicinal cannabis the same, and it doesn't refer specifically to medicinal cannabis. Our cannabis regulations provide the details of how that cannabis framework will be implemented, and it does specifically address medicinal cannabis. So the Act and the regulations have now become the primary law governing cannabis in Canada. So in order for you to obtain medical cannabis, clients have to have that signed medical document from an authorized prescriber, and they have to have an order from an authorized prescriber. And in New Brunswick, that can be done by either a physician or a nurse practitioner. That being said, it's important to note that administration and distribution can only take place if the employer also permits it, along with that medical document and written order. And Susan's going to talk a little bit more about that when I pass it over to her. So now that it's here, it's really important that we check our own biases in relation to cannabis, because generally when we first hear of it, we conjure up these kind of images in our mind. So we think of the hippies and the peace and love and that great Matthew McConaughey tagline of all right. And these are the things that kind of come to mind when we first hear about it. But over time, we're seeing that shift in our perceptions, and we've moved from stigma to acceptance. So like we just said in that last slide, we've gone from stereotyping people who use medicinal cannabis, so the hippies and the stoners, and then we started to maybe make a few assumptions about these people. So, oh yeah, they've had their medicine and they're going to sleep well tonight. Then there was a certain amount of fear mongering that went along. So people would say that it was bad and that people were lying when they said that it was helpful, just an excuse for people to get high. And then eventually we started hearing from people who had those personal stories related to cannabis, and we saw firsthand some benefits from using it, and we started seeing more of it in our workplaces. So that's why it's really important for you to kind of reflect on your own experiences in relation to cannabis and be able to check your own biases. So maybe you've had a family member use cannabis while they were in palliative care, or maybe somebody close to you has used it to manage their symptoms that were related to a disease. I know for me, I have had clients that have used it to maybe manage appetite and pain in relation to cancer, with some really good benefits. And I also had a family member use it in those end stages during the palliative care process to help with the pain. So you probably have your own personal stories surrounding the use of medicinal cannabis. So now that cannabis is legal and we have clients using it for medicinal purposes, it's really important for us to reflect on how that ties into our standards of practice and our code of ethics. So both our standards of practice and our code of ethics are those core regulatory documents that guide our nursing practice, and they state what the minimal expectations for nursing professionals are across any practice setting, regardless of where you work. So when we're providing care to people using medicinal cannabis, we're still accountable to follow our standards of practice and our code of ethics. So that means you have to continue to respect client diversity. You need to respect the client's right to informed consent. You need to be sure that you optimize the client's role in that decision-making and the care process. And you have to advocate for appropriate organizational policies. So it's really important that we remember that. And at times, this can cause a nursing professional to have an ethical dilemma when it comes to medicinal cannabis. So maybe you see some negative side effects that could be harmful to your clients, but then maybe you also see the positive benefits like pain control and increased appetite. Maybe you have internal conflicts related to your perception. So again, it goes back to your stereotypes and your biases that you might have. Or maybe there's just a lack of an organizational policy where you work that's causing you to have that ethical dilemma. So as nursing professionals, we do have the right to follow our conscience if we're morally opposed to something like cannabis as a treatment option. But in keeping with your professional practice, you still have to continue with care until an alternative arrangement has been made to meet that client's needs. So we always have to be adhering to our duty of care requirements, which means we cannot abandon our patients. So that care has to be transferred to another healthcare provider. And we do have a document surrounding duty of care if you ever need to refer to this, and that is on our website. So there's a few considerations for you to go over. Even though cannabis regulations give nursing professionals the legal authority to administer cannabis, there's still some areas to consider before you just go ahead and do so. So first and foremost, there has to be an employer policy in place to support the practice. You can't do anything without that employer policy supporting you. You then want to make sure that the clients have presented you with that authorization and the order from an authorized prescriber, which we said can either be a physician or a nurse practitioner. You then have to consider, do you yourself have the knowledge, the skill, and the competence to administer it safely, evaluate, and identify for any adverse reaction? So this is often an area that gets overlooked. You can't just blindly give it if you don't have that competence to do so. You then want to make sure that the substance can be authenticated and that the dose can be determined. So, and then lastly, you have to follow your medication and your documentation standards. So I'm going to wrap up my part of the presentation with just a few frequently asked questions that I've received before I pass it over to Susan. So a big one is, can I administer client-produced cannabis? So this is cannabis that the client has grown themselves. So again, we have to check our employer policy on this one. So what does your employer have to say about that? And a few examples that I've come in contact with is with Horizon Health. They do not permit the usage or storage of any non-synthetic cannabis within all of their facilities or properties. I looked at a nursing home policy as well, which was pretty similar. So families need to be able to provide the name and the registration details of the vendor. The admitting doctor has to provide the details of the product, which is the dose, the frequency, the route. There has to be an order for it. A label has to be provided by the pharmacy, and it has to be purchased in the form of a controlled dosage system. If where you work is allowing you to give it, if people have grown it themselves, you really have to consider the risks that might be involved and make sure to take the steps to ensure the safety and that it's being documented. So how would you know what is really in that baggie and that it's safe without those parameters in place? Another question I receive is, can clients self-administer their cannabis? So again, we're always checking our employer policy first on this. And we also want to be assessing the client's capacity to do so. So do they have the ability, do they have the judgment, the memory to do this safely? We also want to make sure that there's a documented plan for self-administration, and that plan should include things like the dose, the frequency, the route. What are the expected outcomes? How are you going to monitor that client? How are you going to deal with any potential adverse side effects? A big one is, can I administer cannabis in all practice settings? So subsection 348 of the cannabis regulation allows an individual in charge of a hospital to allow cannabis products to be administered to an inpatient or outpatient. So it's important for you to consider, what is a hospital? So in New Brunswick, the definition of a hospital, it's very broad. So it can include long-term care facilities, addiction services, mental health services, public health services, extramural services, and community health services. So that covers most areas, but there was still a big question mark when it came around home care. But with home care, generally, yes, you can, because the Cannabis Act and the cannabis regulations make reference to administration in a hospital, but also a public place. So a public place includes any place that the public has access to by right or by invitation that is expressed or implied. So in a home care setting, the nursing professional has access to that client's residence when they're invited into the home to provide those nursing services. And of course, we're checking to make sure that there's a policy in place to support that practice. So what if my workplace doesn't have a policy on cannabis? So having these kind of policies, it's what helps us meet our standards of practice. So if there's not a policy in your workplace, we do really encourage you to advocate for one and to engage your employer in a conversation about this. So generally, a rule of thumb for those questions of, can I do this as an LPN? It's a threefold question. So the first thing you want to do is make sure that it is in fact within your provincial scope of practice. You then want to check again, I've said it a million times throughout this webinar, is there a policy in place to support that practice? And then lastly, you have to ask yourself, am I competent to perform this task? Because we know nursing is so broad that there is not one nursing professional in the world that can be competent in all areas of nursing. So you do have to check that whatever practice you're going to be engaging in, that you are competent to perform it. So I'm going to now pass this over to Susan, and she's going to discuss the policy side in regards to cannabis.
Thanks, Kathy. So All facilities of any sort in the province of New Brunswick require policies. And Kathy just talked to you about policies with regard to the delivery of medication or cannabis as a medication. I'm going to talk to you a bit about the other two sides of policy, which refer to the actual employee themselves. So whether it's recreational or whether it's medicinal cannabis, and the policy within the facility. So policies are what provide us with guidelines within which, we're held responsible and accountable. And the advent of legalization of cannabis has created quite a stir, and many documents and discussions are now available as to how employers should create their own institutional policies, no matter how large or small the facility. Both policies need to be considered for the client and the employee. So Kathy's referred to cannabis from the employee administration perspective, and I'm going to speak a little bit more about the employer-employee relationship. So employers are responsible to develop and implement policies based on the best evidence that is out there, and as I say, that evidence is growing daily. So cannabis is legal, however, every employer has the ability to further restrict an employee's involvement in these activities. So an example of a policy in a nursing home may state that employees must refrain from using recreational cannabis during work, and the 8 hours before work, there may be a zero tolerance when it comes to recreational cannabis use. However, medical cannabis use by the employee is recognized with a prescription and must be open. The employee must be open and forthcoming with the employer. So what that means is, if I'm prescribed medical cannabis for a condition and I'm still deemed able to work, I must provide a copy of that prescription to the employer along with the average amount of times it's going to be utilized at work. So the policy must resemble really the substance or alcohol use policies that most facilities have had in the past. So more often than not, now they will either be a fitness to practice policy or a policy about substance abuse in the workplace. So it's a complex issue. We do have a duty to maintain a safe workplace versus the duty to respect the human rights and accommodations. I'm going to refer to that here in a moment. But the bottom line is employees cannot be impaired in the workplace, and impairment would be treated as we would alcohol. So we must report to work, fit to work, and remain fit to work throughout our shift. So there are a few examples here of policies that will require a review within a facility. A lot of facilities have already updated, but depending on the size of the facility will depend on how many policies they have. But we would look at the accommodation of a disability, so that would be a prescribed, code of conduct policy, progressive discipline. The scent-free environment is one that has created quite a stir since cannabis has been legalized. It was not the first and forefront, but it's there. The advent of smoking on the workplace, and alcohol and drug testing. So employers will remain accountable for their actions. Employees will remain accountable for their actions with respect to these policies, just as they have before. So nothing really any different. So employees' use of medicinal cannabis. So I referred to that earlier. So this is when it's been prescribed. So there is a duty to maintain a safe workplace, so the fitness to practice. Medical cannabis requires proper authorization or a prescription and includes the need for the employee to disclose to the employer in a confidential environment, no different than if we were on narcotics that were prescribed that could impair the employee's ability to remain fit at the workplace. Employers have a duty to accommodate to the point of hardship. However, public safety is first and foremost. An employee who uses recreational cannabis, just because cannabis has become legalized does not mean that it's not a license to show up to work impaired. Recreational cannabis is a very different story. It's not allowed at the workplace. It's not allowed during work or rest periods, and it cannot impact the employee's fitness to practice. So we need to know our responsibilities as we're in that relationship with our employer. So we need to think of it this way. You're not allowed to bring or consume or show up following the consumption of alcohol. There isn't any difference here whatsoever. So what happens when we're at our place of employment and there's reasonable suspicion that one of our peers or coworkers has actually consumed cannabis? We actually have a duty to report. So the steps listed here are reasonable and progressive. So we start off with, use your reasonable suspicion. There's obviously something that would trigger us to be suspicious, and so that we do that through our observations, appearance, behavior, speech, actions, keeping fitness to practice in the back of our mind. We can confirm that. So once we're clear in our observations, we can discuss that with the coworker. And most often, if we're in the HR setting, if it's not impacting someone's fitness to practice, they can find out, what's the root cause. So we always need to document that. And then, of course, we're going to report our findings. So, can an institution actually put in place a zero tolerance policy? When it comes to medical cannabis, so that's what we've described as being prescribed, no, there's a risk of human rights complaint. However, recreational cannabis is safety sensitive, so we can enforce it through a proper policy. Recreational use in non-safety scenarios, so healthcare is not considered a non-safety, but I've added it here. We cannot. It's difficult to enforce and would be based solely on biases and stereotypes. So again, this is not allowed, and it would be the same as when it's within alcohol use. The fine line for some people to kind of consider is if an LPN's authorized to use medicinal cannabis, can they still work? It's really, this is where the employee is required to self-disclose with the employer, manager, or the HR representative. It's no different than any other prescribed medication. It has the same implications. They must still be able to provide safe, competent, compassionate, ethical care while meeting standards of practice. That is the vital piece in this. And they must assess their fitness to practice. I mean, that's our own responsibilities at all times as well. And so they have to have the necessary physical, mental, and emotional health to meet the standards of practice in the Code of Ethics. We have that duty to provide care to all of our clients. So the train has left the station. Oops, I think we've missed a slide here. Yeah. So what should I do if my colleague consumes cannabis on their break? So that becomes a professional practice issue. All of the previous scenarios, as we're talking about, that's an employee relationship issue. If someone consumes cannabis on their break, it is a professional practice issue. And we must, first and foremost, do the assessment to verify if the information that wherever we attain the knowledge, whether it was first observation or whether it was reported, that it is correct. If you suspect they are impaired, remember I said reasonable and progressive, so reasonable suspicion, you must first ensure that the client's safety is looked after first. At that point, then you can notify the supervisor or manager and or the employer as soon as possible and document your actions. The employer may need to remove the nursing professional from the practice environment but we look through the lens of fitness to practice and public safety lenses first. So ensuring the safety of clients is our ultimate responsibility. So cannabis policies, we all need them. Most facilities have them. Most of them, if they are smaller facilities, will incorporate them into their substance abuse policies. But the train's left the station. We need to get on board and we need to have this. And as Kathy referred to earlier, if your facility does not have a policy, you can advocate for that because you're advocating on behalf of your clients as well as yourself when it comes to safety. So updates, employers need to create, update, and revise their policies. And as an employee, we need to make sure that we're familiar with our organizational policies. That's a part of our employer-employee relationship and our responsibility. So update them, build internal processes to deal with them, no differently than our substance abuse, and the fitness to practice is broad enough to include cannabis. So if your facility does not have a policy currently, your responsibility within your ability to be fit to practice healthcare actually does encompass the cannabis use. So that's the end of our presentation. I believe Kathy is going to open and unmute so that if anyone has any questions for us, we'll open the floor.
We're ready to take any questions if you have any about the presentation. Everybody's been unmuted, so we're ready if you have any questions for us.
Gonna post your presentation on the website.
Sorry, we could barely hear you. Could you repeat that for us?
Are you going to post this presentation on the association site?
Yes, we are. So we have a tab at the top of our website that says webinars. So we'll try and get that uploaded by the end of today. If not today, it'll be there by the end of the week.
Perfect, thank you.
You're welcome. So if there's no questions, we'll just end the meeting, or if you're a little too camera shy, you can always just email us if you have some questions. Did somebody have a question there?
My question is just, is there any way to get like documentation that we did this if we get audited for the registration thing?
For the continuing competence program? Yeah. So what you should do now is, if you don't already have it printed out already, go on our website and get that record of learning document, and just make sure you note the title of this presentation and the date that you watched it, and be able to pick something out from this presentation that was new knowledge to you. And now that you have that knowledge, how's that going to improve your practice and your patient outcomes? So you're just going to answer those questions on the record of learning document.
Okay, thank you.
You're welcome.
All right, well, thank you all for joining us today, and look forward to you joining us for future webinars.
Thanks for your presentation. Have a good one.
You're very welcome.
Thank you.
Have a good weekend.
You too. No.